Hello, my name is Gael, and I'm here with my teammates Amin and Jan. And today we're going to be talking about the association between COVID-19 and mortality among Asian Americans. The COVID-19 outbreak has been designated by the WHO as a pandemic since 2020. As such, it has reached innumerable populations of diverse ethnic and national backgrounds. In the United States, COVID-19 has disproportionately affected minorities and immigrant populations and exacerbated existing racial and ethnic disparities in health. The objective of the present study is to compare all-cause excess mortality rates in Asian American subgroups before and during the COVID-19 pandemic.
National Vital Statistics System, or the NVSS data from 2015 to 2020 was used to examine the demographics and mortality status of Asian Indian, Chinese, Filipino, Japanese, Korean, Vietnamese, non-Hispanic white, and non-Hispanic Black adults. Data from the American Community Survey, or the ACS, from 2015 to 2020 was also used to retrieve information about population counts for each race and ethnicity. Mortality rates were calculated by using death counts from the NVSS as numerator and population counts from the ACS as denominator. A linked data set containing data from the ACS and from the NVSS mortality dataset from 2015 to 2020 was then used to evaluate trends to investigate the disparities in excess mortality due to COVID-19. Between 2015 and 2019, crude mortality rates increased for all subgroups. Crude mortality rates also further increased between 2019 and 2020 for all subgroups. Finally, Japanese adults had significantly higher crude mortality rates than every other race and ethnicity between 2015 and 2020.
Some limitations to our study include the presence of self-reported items in the ACS, which may cause social desirability bias, meaning that undesirable attitudes may have been underreported and desirable attitudes overreported. This in turn may have led to skewed data. Working with data from COVID-19 also presents unique challenges, as the lag in data reporting, misclassification of COVID diagnoses in 2020, and testing capacities at the time may lead to inaccurate numbers. Moving forward, we will add other Asians as an aggregated subgroup to our study to further investigate disparities between subgroups. We will also perform sensitivity analyses on age and nativity as co-founders. Finally, we will define and analyze excess mortality rates to move forward. Thank you for listening.